Thank you for selecting the University Health Network Toronto Western Hospital campus for your joint replacement surgery. In this video, you will learn about how to prepare for your joint replacement surgery, the importance of actively participating in your recovery, and how to care for yourself during your recovery. We hope to provide you with the tools needed so you can achieve your best possible outcome. While your healthcare team is important to your success, you too play a key role in your own recovery. Your best outcome will only be achieved through preparation and participation. Recovery is not a passive process and involves you being actively involved at each step along the way and invested in your own recovery. You will also be encouraged to identify a co-pilot who will be able to provide support for you throughout your recovery. This is a crucial step in your surgical pathway.
In order to help you achieve your best possible outcome, UHN has created an integrated and comprehensive care pathway that will allow you to receive your entire hip and knee care journey from One Team UHN. The One Team UHN will follow you throughout your surgical journey. This means UHN team members will be involved in your care at each step along the way. From the day of your surgery to your post-surgical treatment at UHN's Eltham Health Outpatient Community Rehabilitation Clinics, we will be there to support you.
We are invested in your recovery, and as such, we will be capturing patient-reported outcome measures, or PROMs. You will be asked to complete surveys about your pain and function before and after surgery to allow us to track your progress over time and plan the best possible care for your unique needs.
You will be required to complete PROMS surveys. You will need to complete these prior to your surgery, 6 weeks, 3 months, and 1 year following your surgery. It is essential that you complete these surveys online in advance of your appointment. PROMs allow us to track your progress in recovery and help us to plan the best care for your needs and for those of other patients.
Your surgery. Joint replacement surgery, referred to as arthroplasty, is a surgery to relieve pain and restore range of motion by reconstructing a joint. During this surgery, the damaged joint will be removed and replaced with an artificial implant. Preparing for surgery. Preparing for this surgery will be vital for a smooth recovery. The majority of patients are ready to go home the day of surgery or the morning after. To maximize your success, you want to focus on 3 key areas of preparation. 1. Preoperative exercise and activity. 2. Home setup. And 3. Identifying and confirming a co-pilot prior to surgery to ensure you have the support you will need during your recovery.
Exercise and activity. The stronger and fitter you are before your surgery, the better your outcome will be. Your orthopedic care guide includes a number of exercises which you can trial before your surgery and will be reviewed in this video. If you are already working with a trainer, physiotherapist, attending a group exercise class, or have your own home exercise program, please continue with your current exercise routines. For others who are not yet active, try to increase your activity level within your tolerance prior to surgery by looking into the options above or doing the exercises in your orthopedic care guide. While you may be experiencing some discomfort with increasing your activity level, you are not doing additional harm to your joint.
Home setup. After your surgery, you may experience a change in balance and energy. It is important to find different ways to perform your daily activities safely while regaining your independence. We recommend that you organize your home so any commonly used items are at waist level within safe reach, that you clear floors and stairs of objects that can cause you to trip and fall, such as loose rugs or electrical cords, that you prepare meals ahead of time and have a good supply of food for your return home. We also recommend that you make your bathroom safe and easy to use, and that you make arrangements to have all needed equipment in place before your return home. You will need a 2-wheeled walker and a cane if you have stairs. You may need a raised toilet seat or commode, shower chair or bath bench, long-handled shoehorn, and reacher. These pieces of equipment can be rented or purchased. Recommendations may vary depending on your surgeon and your own baseline level of function. Arranging for help. If you have concerns about caring for yourself after surgery, you will need to make arrangements before your surgery for a family member, friend, or co-pilot to provide support. This individual does not have to live with you and provide 24-hour support, but should be available to assist as needed with groceries, errands, transportation, and encouragement. If you are unable to confirm a co-pilot, options include private retirement home, respite stays, or private in-home supports to help. Please look into these options prior to your surgery so that you have a plan at the time of your discharge from hospital.
Depending on the timing of your surgery, you may also be instructed to take a chlorhexidine shower. This is an antiseptic used to clean your skin to help lower chances of an infection. Starting 4 days prior to your surgery, take a shower each day using your usual soap. On the day before your surgery and the day of your surgery, take a shower using the chlorhexidine wash. Instructions are available in your orthopedic care guide. You can buy this soap known as stanzahexidine or chlorhexidine wash 2% at your local drugstore.
Learning checkpoint. Questions to the group. Question 1. True or false, it is important to do exercise and be as active as possible leading up to your surgery. Question 2. Where can you find appropriate preoperative exercises? Question 3. What is the role of your co-pilot? And question 4. True or false, my co-pilot needs to be with me 24 hours a day following my surgery.
Day of surgery, what to bring. You will need to pack some items for your stay in the hospital and discharge home. These items include toiletry items, clothing, loose-fitting, non-slip footwear other than slippers, current prescription medications, a two-wheeled walker, and a lock. On the day of your surgery, you will need to arrive 3 hours before your scheduled surgery. Take the elevators located in the Fell Pavilion and go to the second floor. When you exit the elevators, you will see the preoperative care unit, room 116. If you are being admitted after surgery, these are the same elevators to get to the orthopedic inpatient 9A unit, where you will be taken after your surgery. Visitor policy during the COVID-19 pandemic. UHN values the involvement of family members in the care of our patients. However, due to the pandemic situation, there are times when we must rescind our visitor policy to our institutions to ensure the safety of all staff and patients. For questions or to access up-to-date information, please visit www.uhn.ca or contact your surgeon's office.
After your surgery, you will be moved to the day surgery unit or the inpatient unit 9A for the remainder of your stay. During this time, different members of the team will work with you to help you manage your pain, monitor your vitals, and help you to start moving. You will be taken to the orthopedic inpatient unit 9A or day surgery unit after your surgery. Your care team will be made up of several health professionals who work together to assist you in your recovery and will ensure you transition home in a safe manner. Pain. Your team will choose a variety of methods to help you control your pain. They will educate you about these methods and will ask you to report and monitor your pain levels throughout the day. This information is vital to allow your team to make changes in your medication to allow you to move, perform your exercises, and recover. We encourage you to use your pain medication on a regular basis to keep on top of your pain. You can expect mild pain when you are in bed and moderate pain when you exercise and work with physiotherapy. Immediately following surgery, you may have minimal pain due to the spinal anesthetic. Taking your pain medication early is important so that pain is controlled once the spinal wears off. Assess your pain using the 0 to 10 scale every 2 hours, and speak to your nurse if you have concerns about your pain control. Take your pain medication prior to bed and throughout the night as needed to remain comfortable and ensure you are rested. It is important that you control your pain to allow you to be able to move around comfortably. Blood thinners. You will be started on blood thinners to help prevent blood clots. You will be required to take this blood thinner medication for up to 35 days after your surgery. You will receive instructions on how to take your specific blood thinner medication by your surgeon, nurse, or nurse practitioner. Physiotherapy. Our physiotherapy team will start working with you on the day of your surgery. Our team will assess your movement, review your standard exercises, help you to transfer, walk, and perform stairs. They will assist you to prepare for discharge home, which will occur on the day of your surgery or the following morning. It is important to work with your physiotherapy team, as well as other team members, to be up and moving. This will reduce your chances of developing secondary complications such as pneumonia, blood clots, or skin breakdown. It will also get your new joint moving and strengthen your muscles, which will help you regain your independence.
Exercise, walking, transfers, and stairs. Your physiotherapy team will review with you the standard exercises which have been included in the orthopedic care guide. Some of these exercises may have been modified or excluded based on your level of mobility in the hospital. It is important that you perform these exercises 3 to 4 times per day, repeating each 10 times while in the hospital and once you return home. Your physiotherapy team will also teach you how to transfer, walk, and how to do stairs. They will also review with you any movement restrictions recommended by your surgeon.
Learning checkpoint. Questions to the group. Question 1. On the day of surgery, how many hours in advance are you required to arrive? Question 2. What should you bring with you on your day of surgery? Question 3. Who should you speak to if you have concerns about pain control or blood thinner medications? Question 4. When will you be able to stand and walk? Discharge. Returning home. Discharge. Once you have achieved all the goals that are required by the healthcare team, you will be ready to go home. The majority of patients are ready to go home on the day of surgery or the morning after surgery. You will be informed that you are ready for discharge and will need to make arrangements to be picked up the day of your surgery or the morning after by 11 a.m. Please instruct the person picking you up to bring a wheelchair from the main lobby, as the walk from the unit to the car will be too far. When leaving the hospital, you can expect to receive instructions from your nurse at the time of discharge from the hospital, and you will leave with a discharge summary, 6-week follow-up appointment with your surgeon, staple removal kit to take to your family doctor, prescriptions for blood thinners, pain medication, and stool softeners, as well as a UHN Altum Health Clinic post-op rehabilitation appointment.
Discharge. Once you have achieved all the goals that are required by the healthcare team, you will be ready to go home. The majority of patients are ready to go home on the day of surgery or the morning after surgery. You will be informed that you are ready for discharge and will need to make arrangements to be picked up the day of your surgery or the morning after by 11 a.m. When leaving the hospital, you can expect to receive instructions from your nurse at the time of discharge from the hospital, and you will leave with a discharge summary, a 6-week follow-up appointment with your surgeon, staple remover to take to your family doctor, and prescriptions for blood thinners, pain medications, and stool softeners. You will also have your UHN Altum Health Clinic post-op outpatient rehabilitation clinic appointment.
At home. Mobility. It is important that you continue to move, use your recommended equipment, and perform your exercises upon returning home. In selecting UHN Toronto Western Hospital, you will receive access to the UHN Altum Health Outpatient Rehabilitation Clinics. Your UHN Altum Health team will consist of an interprofessional team. Your treatment team will ensure you are moving, strengthening, and improving your function to return to your daily activities. Once again, you will be key to your own success, and the more you do, the better your outcome will be. Your Altum team will support you by providing you with an initial assessment within 1 to 2 weeks after your surgery. They will schedule your outpatient rehab visits based on your recovery goals. They will provide group and one-on-one therapy based on your individual needs. They will deliver care through the expertise of an interprofessional team made up of professions such as physiotherapists, physiotherapy assistants, and kinesiologists. Pain. Pain is normal and to be expected following surgery. It is important to take your prescribed pain medications at home to allow you to be mobile and perform your home exercises. You can expect mild pain, 0 to 3 out of 10 at rest, and moderate pain, 4 to 7 out of 10 when active in performing your exercises. Safe storage and disposal of your opioids. Pain medicine that is not stored or disposed of safely could be stolen or taken by mistake. Store your opioid medicines in a locked drawer or cabinet. Take your unused or expired medicine to a pharmacy for safe disposal. Do not flush medicine down the toilet. Do not throw medicine in the garbage. Caring for your incision. Your incision, which is the cut made during your surgery, will be covered by a dressing. This dressing will last from 1 to 2 weeks. This dressing is waterproof and can therefore be worn in the shower. If the wound becomes exposed before you see your family doctor, it is important that you do not put any creams on the wound. You will follow up with your family doctor at the 2-week mark, and if you have staples, they will remove them and check the incision. Swelling. Swelling is a normal part of your post-operative recovery and should be expected. You can manage your swelling with ice packs, Game Ready, or cryo-cuff systems. These devices can be used both at home and while in hospital. Ice packs should only be applied for 10 to 15 minutes at a time. Place something between the skin and the ice pack, for example, a thin cloth. Prior to applying ice, ensure that your skin sensation is good in that area. Seeking help. Blood clots. When you are at home, it is important to recognize the signs of a blood clot. If the clot begins in the leg, you will have extreme pain and swelling at the back of your calf and perhaps some redness. This can be treated, but you must go to the nearest emergency department. If the blood clot traveled to your lungs, you may experience shortness of breath, a fast heartbeat, and sometimes pain in the mid-back. If this happens, this is a medical emergency, and you need to go to the closest emergency department for immediate treatment. Antibiotics and infections. It is very important to prevent infections at the joint replacement site where a germ can enter your bloodstream. Signs of infections include fever, increased discharge, and redness at the incision. If you have these signs at the incision or an infection in any part of your body, you must consult your surgeon or family doctor for treatment. For future medical procedures, including dental cleaning within 3 months post-joint replacement surgery, you may need to take antibiotics before these procedures to reduce the risk of infection impacting your new joint. Your surgeon will provide you with more specific recommendations related to their own practice.
If you encounter any other concerns upon returning home, please refer to the Key Contacts section in your orthopedic care guide. We want to help address your concerns, and you can reach your UHN team at any time. In partnership with you, we hope to help you achieve your best possible outcome.
Learning checkpoint. Questions to the group. Question 1. How long will you be in the hospital? Question 2. What time is general discharge from the hospital? Question 3. What do I need to have at the time of discharge? Question 4. When should you seek medical assistance, and who could you contact?
Thank you again for choosing UHN for your joint replacement surgery. Your One Team UHN is here to support your journey and ensure that you achieve your best possible outcome.